Good day all. July is Fibroid Awareness Month, and here at Doc Lily OB/GYN Clinic, we are committed to enlightening our patients. We'll be discussing about fibroids, all about fibroids. Fibroids are benign tumors, non-cancerous tumors that grow on the uterus. The cause of fibroids is not known. Many risk factors have been postulated, but the exact cause is not known. It's been found to be commoner in Black women. There are different types of fibroids depending on their location. So we find fibroids on the muscular layer of the uterus, on the muscle of the uterus, which such fibroids are called intramural fibroids. We also have fibroids that grow on the outer body of the uterus, outwards. These fibroids are known as subserosal fibroids. We have fibroids that grow within the lining of the uterine cavity or the endometrial cavity, where normally babies would stay if the individual was pregnant. Such fibroids are called submucosal fibroids. There are also fibroids that are located in the lower portion of the womb, called the cervix. Such fibroids are called cervical fibroids. The common symptoms of fibroid, it depends on the size, because fibroids, depending on the size, sometimes can be like as small as a pea and could be as big as watermelon. So depending on the size, they can cause different symptoms. Some of the symptoms are, patient could present with abdominal swelling. So you find suddenly there's a swelling, sometimes there has been gradually progressing. Some even do not present with any symptoms. They have a scan done and a fibroid is found. Others will present with pain on the abdomen, on the tummy. So they have severe pain either during menses or when they are not menstruating. Others will present with heavy menstrual bleeding, heavy and prolonged menstrual bleeding. Some of them pass thick clots such that they become weak and dizzy. Others will also present with pain during sexual intercourse. Some will present with pain during sexual intercourse. Some will present with what we call pressure symptoms. So they find it difficult to pass stool. Others will pee too frequently. They pass urine very frequently. Now, fibroids usually would be diagnosed depending on the symptoms that some present with. Some, as I said before, don't have symptoms, and accidentally a scan was done and fibroids was found. And some people would have to have a magnetic resonance imaging, MRI, where we can locate the total number of fibroids. It can tell us where they're exactly located and the ease of removal if surgery has to be done. Also, there's the test where the lining of the womb can be looked into. It's hysteroscopy, so it can also be used in diagnosis. So it's like a camera to look into the lining of the womb, and then the fibroids are seen and a diagnosis is made. Now, risk factors of fibroids. Some risk factors have been implicated. It's been found to be commoner in the blacks. It's also been found to be common in the reproductive age group. Now, we find that women are delaying having babies. And as I would say, nature abhors vacuum. So you find that where a baby doesn't grow, you find fibroids growing. So majority of the women with fibroid are either nulliparous or low parity. Nulliparous in that they've never had babies. Now, obesity has also been implicated as a risk factor. Also, for people who started seeing their menses on time due to probably the effect of hormones, estrogen and progesterone, they are likely to develop fibroids. Now, the overall health of a woman can be affected by fibroid in that, for instance, a woman who presents usually with bleeding every month, very heavy bleeding, may miss work, may always be in pain, and this would affect the productivity of such an individual. Fibroids can also impact on fertility and pregnancy. For instance, depending on the location of such fibroids, you can find fibroids that are blocking the tubes. The tubes are where eggs will normally pass to get to meet the sperm. And for fibroids blocking such locations, those individuals may have problems getting pregnant. Now, for those that achieve pregnancy, they may also have miscarriages, as the fibroids may become bigger when they get pregnant. It may also be difficult for them to have a vaginal delivery if, for instance, the fibroid is in the cervical region, the lower portion of the uterus. Now, there's genetic predisposition to fibroid, in that, for instance, you find women whose mothers or sisters had fibroid are also likely to develop fibroids. Now, this is all we'll be talking about for fibroid for the month of July. Feel free to drop your questions in the comment section. Thank you.